Good day, I am Lali Bebsti Cavisillas from BSN 111F of Davao Doctors College. So today I will be assessing the thorax and lungs. So assessing the thorax and lungs is frequently critical for the client's oxygenation status since change in respiratory system can occur either quickly or slowly. So the first thing we need to do is to review the client's medical records if available for us to know the previous medical history of the patient to provide focus for the physical assessment of the patient and to determine the scope of assessment needed and prepare necessary equipment, save us time and effort. So the equipment we need are examination gown, working gloves, our stethoscope, and a drop light or any other light source, skin marker, and our tape measure. Now, after we ensure that the necessary equipments are present, let us now perform hand hygiene to deter the spread of the microorganisms. So now that we are done, let us go and meet our client. So here, we first proceed to greeting the client politely and the client's companion if around. Then we have to introduce ourselves and verify the client's identity and ask how the client would like to be called during the assessment. And also it is important to establish rapport with the client. Thus verifying the client's identity helps us to know if we have the correct client. Also greeting and establishing rapport with the clients makes them feel comfortable and less anxious. After that, I will explain the procedure to the client and how she can participate during the assessment. I will then provide the client the opportunity to clarify, ask, and raise any concern. This is done to elicit cooperation from the client and providing the opportunity to ask help for us to know if there's more information that our client would like to know about. So, good day, ma'am. I am Lali Bebsti Cavisillas from Davao Doctors College, and I'll be going to be your student nurse who will be assessing your thorax and lungs. So, ma'am, for verification, may I see your wristband? Okay. Can you state your complete name, please?
Nicole T.R.D.
How about your birthday, please?
June 11, 2002.
Thank you. So, all right, ma'am, how would you like me to address you?
You can call me Nicole.
Hey, Nicole. So, ano pong gusto mong lingwahe ang gagamitin natin sa ngayon? Assessment po.
Can I use a vernacular language with basic English?
Okay, so, as I've said, ma'am, karon po kay mag-assess ko sa imong thorax and lungs. So kana siya, ma'am, kay mo gamit tag kanang mo proceed tag inspection, palpation, percussion of auscultation. Sa inspection, ma'am, tan-awon nako imuhang body figure, imuhang chest configuration po. Tapos sa palpation, mugunit ko, ma'am, sa parts sa imong lawas. And also po sa percussion, ma'am, mugunit po ko. Tapos sa auscultation po, ma'am, kay magamit ko stethoscope na ako sa imong lawas. So, okay lang ba dadira, ma'am?
Yes, ma'am.
So, before ana, ma'am, kay na ako yung mga ipangutan ng question. Regarding that, ma'am, ang mga question ana, ma'am, kay about sa imong health history po. Sa imong family ba, current, past, o sa imong lifestyle. Okay lang po ba, ma'am?
Okay lang.
Okay. So, start ta, ma'am, sa questioning. So, ma'am, dili po, ma'am, importante po, ma'am, nga mutubag ka o tarong o tinuod para kami makabuhat og mas maayong plan para sa imuhang ano po, sa imuhang as for us nurses po, for your care plan. Will that be alright po?
Yes.
Okay, so, ma'am, kanang for your current symptoms po, napa kay mga nabating paglisod sa ginhawa?
So far, wala akong nakita.
Okay, mga sakit sa dughan po, wala ba?
Wala.
How about ubo po?
Wala ma'am. So far karon wala.
So, sa gastrointestinal symptoms po, ma'am, na ba yung mga nausea, diarrhea, or mga sakit-sakit sa abdominal area?
Makapi lang kapag red days.
Okay. So, proceed naman. Naaba sa imuhang family po nga na ay respiratory problem?
Wala.
So, niagi na ba, niagi na ba kag trauma or any thoracic surgery?
Wala.
So, okay, nice. So, how about sa imuhang medication intakes po na kay ginatumar karon?
Wala ko rin.
O sa una po na kay mga ginatumar?
Wala.
So, allergies, ma'am.
I don't have allergies.
So, na ba kay mga previous diagnostic or mga lab results po?
No, wala. Positive. Panaan. So far.
Okay. So, sa imong family, ma'am, na ba yung mga na-possess of mga lung diseases?
So far wala ko to.
Okay, nice. So, sa imong family, ma'am, na ba yung mga manigarilyohay?
Yes, akong pa.
Okay, so how about sa lifestyle po, na kay gina-follow nga diet?
Wala ko ginapalaw na dahil.
Okay, nice. So, sa ano ma'am, na kay ka nang panigarilyo ka ma'am?
Dili.
So, did you expose yourself po ba sa mga environmental hazards? If ilang papa po manigarilyo, duol ka?
May times na mag-dual siya sa kwaso. Kailangan ko malayo pero makasimhot yung gapon ko.
Okay. So, ano ma'am, kanang other than that ma'am, naaba ka exposure pa na ng mga environmental hazards?
Sa gawas,
Kanang mga abog lagi sa kinang ma'am? O other than that ma'am, naaba ba?
wala.
Okay, so, ikaw ma'am, nakay ginasunod nga exercise?
Wala.
Okay, so, nagatulog ba kagtarong ma'am? Kanang irregular ba inyong sleep routine?
Dili ko.
Unsa man ka oras kanang mostly nagatulog?
These days, mga 11.
Okay. So, perhaps mo na ba kayo follow such as acupuncture, na ba ma'am?
Wala.
Okay, thank you ma'am. So, karon ma'am, we'll now proceed to your assessment. So, dere ma'am, kailangan ako i-remove imong sanina, pero pasuoton man ta kag lab gown o i-expose lang nako ang mga area nga ako ang i-assess. O katong mga area nga dili na ko i-assess ay i-remain covered po. Okay lang po? Okay, so sa ano ma'am, so mag-start ta sa imong posterior sa likod sa imong lawas. So, mag-inspect ko, mag-palpate, mag-percuss, o mag-auscultate. Auscultation lang magdungag lang ko nga na ako yung mga instruct siguro sa inyo ha, o pronounce or breathing. So, I will ask for your cooperation for that. Okay lang po?
Okay.
Sige, proceed naman. Now, we proceed on checking for any signs of respiratory distress such as nasal flaring, pursed lip, breathing, and retraction or problems with oxygenation. So, ma'am, can I have you remove your mask po? So, remember to observe the color of face, lips, chest, and fingernails because intercostal retraction, nasal flaring, and pursed lip breathing indicate airflow obstruction and poor ventilation. And can you lend me your hand po? Okay, so as I have inspected my client, there are no signs of respiratory distress. So let us now proceed to assessing the posterior thorax and lungs. Here we inspect for configuration. Chest configuration refers to the overall structure of the chest, such as shape and antero-posterior diameter versus transverse diameter. So have the client stand with both arms on the side, then I'll stand behind the client and observe the position of the scapulae, the shape and the configuration of the chest wall. Any abnormal findings such as funnel begin and barrel chest or any must be noted. So ma'am, can you stand po? Okay. Can you have your both hand po sa gilid niyo po? Okay. Stand straight po. Okay, so after stand still lang po. Then let us now inspect for the spinal alignment to determine any abnormal curvature of the spine. So in a lateral position, observe the three normal curvatures: the cervical, the thoracic, and the lumbar spine. So here, can you turn around na? So here, the cervical, thoracic, and the lumbar spine. To assess for its deviation, observe the standing client from the rear and have her bend forward at the waist and observe from behind. So ma'am, can you bend forward po? Bend ka forward. Okay. So you can now sit down, ma'am. And also wear your mask if you are uncomfortable po. So now let us proceed on palpating the posterior thorax. So can you sit behind po? Tubang dito sa likod ma'am. So ako na abihan ang likod ni mo ma'am ha. Mugunit na start karon ma'am. Okay ma'am? Okay, so assess for its temperature, its skin integrity, palpate all thorax areas for bulges, tenderness, or abnormal movement. So remember to avoid deep palpation for painful areas, especially if a fractured rib is suspected. In such a case, deep palpation could lead to displacement of the bone fragment against the lungs. So ina lang po lang ha, if sakit akong pag-anon, sila atay gramatera. Okay, so now then we palpate for the respiratory extorsion, which is the movement of the thoracic diaphragm during breathing. So here we place the palms of our both hands over the lower thorax or the T9 and T10 with your thumb adjacent to the spine and your fingers stretched laterally. So it's like a butterfly figure. Like this. Okay, so ma'am, can you take a deep breath? So while the client is doing that, observe the movement of your hands and for any lag in movement. Can you take a deep breath again, ma'am? Okay. After that, we palpate for the vocal fremitus to assess for increase or decrease of lung density. We place the palmar surface of our fingertips or the ulnar aspect of our hands or closed fists in the posterior thorax, starting near the apex of the lungs. So we repeat the two steps subsequently. We instruct the client to voice out 1, 2, 3 as we go down to the base of the lungs and compare as suggested. So, ma'am, kunin ko ma'am ha. So, ingon o 1, 2, 3 ma'am.
1, 2, 3.
Usap ma'am.
1, 2, 3.
Isa pa.
1, 2, 3.
Isa pa ma'am.
1, 2, 3.
Isa ma'am.
1, 2, 3.
Isa pa ma'am.
1, 2, 3.
Okay. Isa ma'am.
1, 2, 3.
Isa pa.
1, 2, 3.
Isa pa ma'am.
1, 2, 3.
Usap.
1, 2, 3.
Usap.
1, 2, 3.
Usap.
1, 2, 3.
Okay. Isa pa ma'am.
1, 2, 3.
Okay. Last one.
1, 2, 3.
Usap.
1, 2, 3.
Okay. Thank you ma'am.
So after the palpation, we move on the percussing the thorax to assess for lungs resonance. First, we ask the client to bend the head and fold the arms forward across the chest. So, ma'am, can you bend your head po? Tapos ito pang ano ka mo sa inyo. Tuhod ito po. I-cross po. And then, this method separates the scapula and exposes more long tissue to percussion. We then percuss in the intercostal spaces at about 5 cm or 2 inches intervals in a systematic sequence. Compare one side of the lung with the other, so percuss the lateral thorax every few inches, starting at the axilla and working down on the ape. So I will touch you both now again, or percuss with the finger po. Now that we are done percussing the posterior thorax, let us now proceed on the measuring the diaphragmatic excursion still by the use of percussion. This identifies the level of the diaphragm during breathing. So we percuss downwards from the above the expected level of the diaphragmatic dullness until dullness is definitely heard. Mark the level of full expiration. So, ma'am, I will mark your back po. Okay lang po ba? Had the patient inhale deeply and hold it in. Then percuss downward to the level of dullness and full inspiration and mark it. Repeated this process on the other side. Then measure the distance between expiratory and inspiratory levels of dullness. So, ma'am, karon kay mugunit na po ito sa inyong likod. Tapos, mag-mark lang po ka na erasable marker po or non-permanent. Okay na po ba? So, ma'am, can you take a deep breath po? Inhale and exhale. Inhale, exhale, and hold it po. Next, ma'am, can you inhale and hold it for a while po? So, inhale, ma'am. Hold it for a while. Okay, next, ma'am. You can breathe normally na po. Thank you. So, next, ma'am, the other side na po tayo, ma'am. So, again, inhale, exhale, and hold it po. Inhale, exhale, hold. Okay, ma'am, next, again, inhale and hold it for a while. Inhale. Okay, hold it for a while, ma'am. Thank you. Breathe normally na po. Okay, then we will measure the distance between the expiration and inspiration. Here we auscultate for the breath sound to assess airflow through the airways. We do it by placing the diaphragm of the stethoscope firmly and directly on the posterior chest wall and the apex of the lung at C7. So we assess for each area of auscultation using a systematic zigzag procedure used in percussion. Remember to listen at each point to the breath sounds during ventilation. Then compare the findings at each point with the corresponding point on the opposite side of the thorax. Note, The location and the chest wall where adventitious sounds are heard, as well as the location of such sound within respiratory cycle. So, karon ma'am, kanang mag-auscultate na ta ma'am, so magamit na kong stethoscope. So, can you breath po through your mouth deeply? Okay, start pa ma'am ha. Okay, so start pa ma'am. Can you take a deep breath? Deep breath ma'am. Inhale. Exhale. Breath through your mouth po ma'am ha. Yan na. Inhale. Exhale. Next. Inhale. Exhale. Next po. Inhale. Exhale. Next ma'am. Inhale. Exhale. Again. Inhale. Exhale. Inhale. Inhale. Exhale. Again ma'am. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale ma'am. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Lastly ma'am. Inhale. Exhale. That we're done doing that, can now proceed on auscultating by the voice sound this time. So we will do the same procedure earlier. So place the diaphragm of the stethoscope firmly and directly on the posterior chest wall and the apex of the lung at C7. And a tip: if you can hear an abnormal sound during auscultation, always have the client cough, then listen again and note any changes because coughing may clear the lungs. Auscultate for the bronchophony sound. So we will have our client speak 99 for each area of the auscultation using the systematic zigzag procedure used in percussion. So ma'am, I will again auscultate you po. Can you say 99 po when I told you so? Okay lang po? Say 99 please.
99.
Again.
99.
Another one.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And last.
99.
Okay, thank you, ma'am. So after checking for the bronchophony sound, let us now proceed on the egophony. So still using this systematic zigzag procedure used in the percussion, but this time, ma'am, can you say E? So let's start here. Can you say E, ma'am?
E.
Okay, again, ma'am.
E.
Again.
E.
Another one.
E.
Isa pa po.
E.
Isa pa.
E.
Isa pa.
E.
Isa pa.
E.
Then,
E.
isa pa.
E.
Last.
E.
Okay, thank you. Now that we are done on the egophony sound, let us now proceed to the whispered pectoralique. So here, still using the zigzag procedure, but this time, can you whisper 1, 2, 3, ma'am? Just whisper 1, 2, 3. Will that be alright? Okay, so start, ma'am. Another one. Another one. Another one. Another one. Another one. Again. 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 Okay, I see that. Okay, thank you. So, do not forget to listen at each point of the breath sound during ventilation. Then, of course, compare the findings at each point with a corresponding point on the opposite side of the thorax. Again, note its location in the chest wall where adventitious sounds are heard, as well as location of such sounds within the respiratory cycle. Okay, now that we are done assessing the posterior thorax and lungs, let us now proceed on assessing the anterior thorax and lungs. So here first we inspect for the breathing patterns because various respiratory patterns have localizing significance in the patient with altered consciousness. So observe the characteristic of the chest rise and fall and its rate.
So, ma'am, I would like you to breathe normally.
Okay. After that, we proceed on inspecting the costal angle to evaluate expansion of thoracic cage. Note for any abnormal findings. After that, we proceed on inspecting the costal angle to evaluate expansion of thoracic cage. Note for any abnormal findings.
So, ma'am, can you remove your unbutton?
Kailangan ito kita. Ano ito na? Ate, bitadilid ako ang grado niya.
So after inspecting and noting if there are any abnormalities, let us now proceed on palpating the anterior thorax. For its tenderness, sensation, surface masses, crepitus, and firmitus. We do it using our fingers, so palpate for tenderness and sensation. After inspecting and noting if there are any abnormalities, let us now proceed on palpating the anterior thorax for its tenderness, sensation, surface, masses, crepitus, and firmitus. We do it using our fingers, so palpate for any tenderness and sensation. Palpate with your hand position over the left clavicle, which is located over the apex. So, before I proceed, ma'am, mugunit ang foot ko, kailan? Expose na to ang kaninga area ko, kailan? So, locate over the apex of the lung and move your hand left to right. And then compare findings bilaterally. Remember to move systematically and accordingly as suggested, then repeat for crepitus and firmitus. Let us now palpate for the respiratory excursion, which is the movement of the thoracic diaphragm during breathing. So place the palms or both hands along the lower rib cage with your thumb along the costal margin. It seems like a butterfly, like just the palpation during our posterior thorax assessment. So,
Ma'am, can you face me? So, can you take a deep breath? Again.
So by doing that, observe the movement of your hand during the breathing of the client. So now we proceed on percussing the anterior thorax to assess for lungs resonance. We begin above the clavicles in the supraclavicular space and proceed downwards to the diaphragm. Then compare the lung on side and the lung on the other side. If your patient is female, displace breasts to facilitate percussion of the lungs. Now that we are done with the percussion of the anterior thorax, let us now proceed on the auscultation. So here we auscultate for the breath sounds, specifically the trachea and the anterior thorax. This is to assess airflow through the airway. Then place the diaphragm of the stethoscope firmly and directly on the anterior chest wall.
Oh, ma'am, we're going to proceed on auscultation po. Ano na ko, ma'am, ha? ano ka ma'am, kanang pwede mag-breathe ka through your mouth po. Okay, so start pa lang tayo. Breathe po. Okay, thank you. I am done with the assessment na po, ma'am. Manan ako sa inyong anterior and posterior. So, karon ma'am, ako na lang i-summarize, tanan akong nabuhat if na ako nakita ang abnormalities or wala. So, ma'am, as you can see kanina, during the katong gipa-inspected ka ma'am, there are no thorax deviation, and as I auscultated your breathing sound, I can hear a vesicular sound on your peripheral lung and bronchivesicular sound between your first and second intercostal space lateral to the sternum. Also, your bronchial sound over the trachea. I also don't hear any adventitious sounds or abnormal breathings and has a clear cough. There are also no presence of respiratory distress. And your respiratory rate, ma'am, is 16, which is normal. All in all, ma'am, you have no any abnormalities with your thorax and lungs. So thank you for your cooperation, ma'am. Now we perform hand hygiene. And now we document everything. Again, ma'am, thank you for your cooperation.